Good morning and welcome to everybody. Thank you for making time to attend on short notice. The intent of this meeting is to share strategies being used by the Department of Mental Health and the Department of Health and others to promote innovative ways to help Vermonters build strengths, feel connected, because we know that is very critical to suicide prevention, and reduce suicide risks during this challenging time. I want to just start with a recognition of our participants and presenters by going over the agenda. We have an extensive array of partners in this work and at the table today. We'd like to welcome all who are participating and able to join us for this special meeting. We have representatives today from healthcare, ranging from physicians to senior care to the VA and Veterans Outreach. We have somebody representing the dental community, as substance misuse prevention, etc. We have several institutions of higher ed and their representatives joining us this morning: Castleton, Landmark College, UVM. We have a number of nonprofit organizations at the table, including Center for Health and Learning, the Copeland Center, NAMI Vermont, New England Poison Center, Pathways Vermont, Restorative Justice, and Vermont Federation of Families, and others that I may not be mentioning. Again, we will be happy to provide a participant list. Thank you to our DA partners, designated mental health agencies, who continue to show a commitment to this work: United Counseling Service, Lamoille County, Counseling Services of Addison County, and Northeast Kingdom Howard Center HCRS have all registered for this meeting this morning, along with Vermont Care Partners. We have some school partners at the table, community partners, including criminal justice, the Center for Restorative Justice, Homeless Shelter, Domestic Violence is represented today, and Substance Abuse Prevention Coalitions. I'd like to recognize that we have a member of the legislature who has registered and hopefully will be joining shortly. And special thanks to our persons with lived experience representing their own individual experiences, as well as the American Foundation for Suicide Prevention, people with disabilities, and psychological survivors. So thank you all very much. I'd like to do a quick review of the agenda. I'd also like to recognize Melissa Farr, CHL Program Specialist, who has been the backbone for organizing this meeting and is in the background managing the time and chat. All coalition-related questions and suggestions can be directed to Melissa at melissa@healthandlearning.org. Do want to do a quick tech check reminder due to the number of participants. At this time, we're asking that you close your cameras and mute yourselves during the meeting. We will be recording the meeting, and all meeting materials and the recording will be sent in a follow-up newsletter from the Vermont Suicide Prevention Center and will be available on the VTSPC website. We begin our meeting with photos of the You Matter Youth and Young Adult Rutland team, bringing you a message of hope and resilience. These opening slides are photos of a beautiful community action project that was completed by Rutland High School and sent out to the community through press and other means as a message of hope and resilience during this challenging time. They planted a tulip hope garden in the fall, and they recently got back together with safe physical distancing to take photos of how it looked this spring. Please type your announcements that you would like shared at the end of the meeting in the chat box, and we'll make sure you get to share them at the end. And I would like to say a special word about sensitive language. Next slide, please. Next slide, please. Thank you. Again, just a reminder about the importance of language and that we're all working to be better at the use of language that destigmatizes mental health in large and suicide prevention. When we come together, we try to talk about suicide using these terms and remind one another the importance of this. A brief overview of our agenda. We're going to start the meeting with an update from Department of Mental Health and a brief report from Department of Health on current suicide data for Vermont. We'll then go into the main portion of the meeting, which is a conversation with coalition members about prevention strategies we are and want to prioritize. We will conclude the meeting with a brief focus on post-vention after a suicide and then end with announcements. Please actively use the chat function because that will be a major way for us to stay in community and conversation. Thank you. At this point, I'm going to turn it over to Commissioner of Department of Mental Health, Sarah Squirrell, and Director of Quality and Improvement, Alison Krompf. They will be giving us an update from the Department of Mental Health. Commissioner Squirrell. She may be muted. See?
Okay, I just unmuted myself. Thanks all. I certainly understand that having the cameras off for large meetings because it can slow the audio is important, but certainly if it's possible, JoEllen, if my camera can be turned on so folks can see me, that would be wonderful, but certainly understand if that's not possible.
That's great. We will do that, Sarah.
Okay, thank you. Okay, well, hopefully folks can see me. Good morning. Thank you for the introduction, JoEllen, and thank you for you and your team at the Center for Health and Learning for convening us all here today. I certainly hope that everyone is doing well and staying safe during these unprecedented times. And I think it is so important that we come together right now as a coalition to make space to really explore together how we can continue to keep Vermonters safe, as well as grapple with the impacts of COVID-19. I think that across our human service system and our communities, we will be hearing the echo and feeling the shadow impact of COVID-19 for many months, if not years to come. We certainly on this phone call all understand the ongoing stress, the uncertainty related to the coronavirus pandemic, which can lead to increases in mental health concerns, feelings of hopelessness, and of course, increased feelings of isolation. We're also aware of the research and some of the links between economic upheaval, suicide, and substance use. I think we also have to keep in mind that there are many groups that are particularly vulnerable that we want to be thinking about. Groups that are at higher risk of suicide, including the elderly, Native Americans, those who identify as LGBTQ, New Americans, and those who are struggling with mental health and substance use issues. We also know that suicide is not an issue that solely impacts those with mental health issues. Suicide can impact all of us at any given time, and many of us experience challenges in our lives or see our loved ones, our children, our youth or friends struggling. The weight of those challenges and stressors can lead to thoughts of suicide. We also know that the potential shadow impact of COVID-19 is not inevitable, and we know that suicide is preventable, which is why I think it's urgent and important that we act now. And given the incredible expertise of all of you on this coalition, I know that there is broad and deep understanding of the risks to Vermonters, and I trust and know that there is awareness and appreciation that suicide is preventable. And this morning, I hope that we can have a conversation that will strengthen all of our efforts by improving our understanding of regional activities, articulating some of the gaps and opportunities that we have right now as systems partners, and aligning messaging that will really amplify the collective expertise of this coalition. I certainly think, and we all know and probably agree, that no single group or approach will solve this, that it requires a collective answer, collective vision, and collective action. We also know that screening, treatment, access to therapeutic supports, crisis and support lines are critical interventions that can and do make a difference, which is why there is so much hope on our Vermont horizon, and which is why we as leaders across the state need to lean in. So the Department of Mental Health and AHS have been actively working on enhancing and growing our suicide prevention efforts across the state, particularly in response to the COVID-19 pandemic. And we are certainly concerned about increased risk of suicide during this time. I'm just going to note a few of the things that we've been working on and focused on. Of course, number one is enhancing our policy and fiscal flexibilities to promote access to care during COVID-19. The impact of COVID-19 significantly shifted how we provide mental health services and supports across the state. And this push into telemedicine, I think, is actually a really good thing for our state. And continued leveraging of telehealth and telemedicine, I think, will continue to make services and supports more widely available and could actually further expand and continue to provide more flexibility, which could in turn continue to improve access to treatment and supports. So those are policy areas that we at the Department of Mental Health, AHS, our partners at DIVA, are continuing to look at. The Department of Mental Health also applied for a SAMSHA emergency suicide prevention grant for $800,000. And we do hope to find out in the next couple of days if we've received that. And that would build upon the existing work and efforts, provide dedicated staffing to lead prevention work across the state. We've been working hard to develop prevention messaging, disseminating materials across multiple outlets. I've recently recorded several PSAs. The governor and administration have been supportive of PSAs, trying to get the word out, trying to get information about prevention, how to access resources and supports more publicly available. And I think this group can actually help us continue to think how we expand that. We're also, of course, looking to continue to leverage all of our partnerships and assets at the state level to lift up our resources. We've been working closely with the Vermont State Police. They have a very robust social media following, the Department of Health, as well as the governor's office. And of course, we are very, very carefully monitoring the weekly suicide data so that we can stay responsive and understand the impact of COVID-19. We want to use that data to translate it into information, use that information to give us more insight, and use that insight to help drive action. And of course, we'll continue to work side by side with the Center for Health and Learning to plan for, I believe, what will be the August symposium, which will be another opportunity for us to come together, to be reflective of the current challenges and opportunities, and to ensure that we as a state are doing everything that we can to be responsive to Vermonters' needs. And I think that's what we should be focusing on right now, is what is the opportunity for Vermont? How do we leverage the strengths and assets of our system to promote suicide prevention? And I think we are very, very well poised to do that right now, and to continue to bring to scale our suicide prevention efforts across the state of Vermont. So I think today is a day that we can double down on our commitment to suicide prevention, really commit to a collective vision and collective action that will result in significant impact to support the health and well-being of Vermonters. And again, I just want to thank everyone for their continued dedication, for taking the time to be on this call this morning, and we will continue to forge ahead together, leveraging all of our collective expertise to support Vermonters. So again, just want to thank everyone for your time and joining us today. And I'm going to turn it over to Alison Krompf, who's going to talk in a little more detail about some of the efforts of the Department of Mental Health and some of the outcome of some of our efforts to date. Thanks, JoEllen.
Thank you, Commissioner Squirrell. And good morning. I'm Alison Krompf. I'm the Director of Quality and Accountability for the Department of Mental Health. And as you've seen in the agenda, at the end of today, we'll be soliciting some input, some feedback, thoughts, innovative ideas. And before we do that, we thought it'd be good to walk through what we know about the elevated risk factors due to COVID-19, what data we have, and give you an indication of what risk mitigation factors we put into play already, so that can help ground us in our discussion later today. So I first wanted to start out by showing the next two slides are about the increased risk factors due to COVID. And I will highlight that I took these almost verbatim and directly from a really good recent publication in the Journal of Psychiatry published by the American Medical Association. And I've cited it here, and I encourage people to take a look at it. But it's stuff we were already looking at, but the article just really breaks it down really clearly about the categories that need to be addressed. And so one of the things right off the bat we knew when quarantine came as a result of COVID-19 was with economic stress comes higher suicide rates. Historically, that's always been the case coming after economic downturns. Additionally, as those of you who have been a part of the Suicide Coalition for a long time, we talk constantly about how we can build better connection for all sorts of groups. Vermont's a rural state. Bringing people together can sometimes be difficult, especially with transportation issues. And so there was immediate concern about the limitations with connecting during this time. Additionally, research supports that religious supports, spiritual, community-based supports are a really good protective factor. And that is something that has been lost during this time, at least in person. And so that's something that we know we would like to be able to try to replace and maintain a fabric for throughout the COVID pandemic. The Department of Mental Health and the Department of Health are very much looking at barriers to treatment and trying to remove them. But lack of face-to-face options, we know internet is not necessarily working perfectly all over the state. So even if we do get telehealth, it may not solve all the problems, and some people may not be comfortable using it. Additionally, we're aware, it was seen right away, there was a large suppression in people reaching out for supports of all kinds. And we saw less calls to the domestic violence hotline. We saw less calls to the crisis lines right off the bat when COVID hit. And we attribute that to a perception that the system is too overwhelmed to help, so I'm just not going to call right now. So we're aware that that can be a barrier for people who are feeling like, you know, already a burden and not wanting to reach out. Another really important note is that healthcare professionals have increased rate of suicide, and especially during a time of stress, that's something that we're particularly tuned into. And I know, as someone who has been a clinician myself and work at the Department of Mental Health now, we often talk about suicide as if it's for other people to determine their risk factors and assess. But it's not other people, it's us, it's all of us. It does not discriminate. And so one of the first things that we like to highlight is think about whether or not you have a policy at your own organization for your own staff high risk for their colleagues and for themselves. AHS has just gone through that process to create a suicide prevention policy. Next slide. The other risk factors I wanted to highlight that are related to COVID-19 are, we know individuals experiencing illness and medical problems are at higher risk of suicide. That's come out in the VDH data briefs. And obviously COVID-19 itself can create an increase in illness and stress, but also persons experiencing an illness who may have treatment interruptions or be concerned about attending appointments. It can additional stress to already stressful medical conditions. Something this article talked about that I personally found fascinating and may decide to study for the rest of my life is the outcomes of national anxiety brought by the 24/7 news coverage. And I think the article does a great job of saying it's an issue that deserves more study. But I think anecdotally, we could probably all admit we all feel it when you're watching the news 24/7 and following something that's extremely stressful. The entire anxiety of the nation goes up, which can impact an individual's anxiety and depression, as well as put them at increased use for substance use. One really important data point that we've talked about a lot in the coalition that's been reflected in the beginning of COVID-19 was there was an increase in firearm sales. And we know that that is correlated with suicide deaths, and the majority of suicides this year have been by firearm. So seeing that that increase is happening, we are definitely tuned in to how we can talk more about counseling on access to lethal means. COVID-19 also falls during the time of year where we often see a peak in suicide, and that is late spring and early summer. So we're simply aware of the fact that those are two risk factors that are happening at the same time. And the last one I wanted to highlight was relationship stress and domestic violence. Staying home to stay safe is a really important message, but not everyone's home is safe. And we have seen, we've spoken with our domestic violence partners, and in fact, the SAMSHA grant we've applied for has a piece of it that must be worked out with domestic violence. So we need to partner as part of that grant. 20% of the funds or 25% of the funds need to go to support domestic violence victims. And it's not just domestic violence. I don't know how many of you are home with a spouse or partner who you don't necessarily see 24/7. Relationship stress is one of the top needs people are calling in for. And so we're aware that that's at increased risk during this time. Next slide. So current actions and risk mitigations, the Department of Mental Health and the Department of Vermont Health Access, we have approved additional telehealth and telephone flexibilities for service provision. That was something that CMS allowed us to do, gave some flexibility on early on, and we have taken advantage of those flexibilities. And we intend to continue to do that for as long as face-to-face visits are not recommended. We're also going to look at which of those might benefit from staying in place if they're allowed under CMS ongoing. Additionally, we want to make clear that access to mental health care is available. Designated agencies are still open. We've seen, many of you might have seen promotions in newspapers and online to say, hey, we're still here, we're open, and we're trying to really make sure that message gets out, and Vermont Care Partners does that very well as well. But it's worth saying again to this group that those services are still available, as well as the crisis text line and the National Suicide Prevention Hotline. Those are available 24/7, and I'm going to show you some data on recent utilization, and they are experiencing an increased use since COVID-19. The other risk mitigations we're putting in place is looking at funding. Not only have we applied for the emergency prevention grant opportunity, but we also, we've applied for a CDC grant opportunity, and we're also working on emergency funding for designated agencies to help provide the telehealth and technology support, and also just ensure that there are mental health clinicians still in work when this is over. We know that the mental health risk of the pandemic is probably going to peak later than the health risk. And so we really are trying to work hard to keep a large cadre of committed, skilled mental health workers in Vermont who are available as this goes on. And lastly, as Commissioner Squirrell spoke about, we've tried really hard to create some good awareness campaigns aligned with the Department of Health. We worked with state police. You'll see some of those coming out on radio. There was a really adorable video with the puppy from the state police who's apparently famous, which I hadn't heard about, but he is really cute. And they did some work with that, as well as we've got the famous drag queens of Vermont are also working on some public service announcements for us. Next slide. Sorry, my dog apparently sees something. Okay, so I did want to highlight some data, and this is data from the crisis text line. And so just in case anyone has not heard about the Vermont crisis text line, we do have a 24/7 crisis text line. You text the letters VT to 741-741. We have seen an increase in texters to the crisis text line from Vermont. It went up 45% in April. We're still waiting on the May data. We were able to take a look at it and see some interesting changes. We saw that one thing that obviously we want to look at is people calling in for suicide. But what we've noted is the percentage of people calling in for suicide has really not changed since COVID, or texting for suicide. However, we have seen a really inverse relationship from people calling for school stress versus calling for being in isolation. And so that might make sense, right? Given that we have young people who have finished school but are now feeling incredibly isolated. Okay, next slide. So one thing that I thought was really important to highlight as we're looking at this data from the text line, the demographics of those accessing the crisis text line are notable. The majority are young, 62% are under age 25. And what I found really interesting and also really encouraging, 65% of texters to the crisis text line identify as LGBTQ+. When I saw that data point, I thought a lot about it, wondered how it came to be, and I reached out to Outright Vermont, and they said they have been really actively promoting this resource. So I let them know it's working. And as we know through the Youth Risk Behavior Survey, LGBTQ youth particularly are at higher risk of suicide, and we're really encouraged to see that they're utilizing this resource. They provide feedback on how helpful they found it to be, and so far that feedback has been incredibly positive. The other thing to note is those utilizing the crisis text line are more racially diverse than our Vermont demographics. We have higher percentages of those identifying as Black, Native American, Hispanic, and Asian. And that to me also is a really encouraging data point, in that we want to make sure that we have resources that feel welcoming to communities and populations that have traditionally felt fairly marginalized. And so right now we're seeing this as an interesting opportunity, but also something that we want to make sure more and more people know about. Next slide. The other data point to highlight in regards to national lifeline and hotlines is we have a Vermont center that answers calls for the National Suicide Prevention Lifeline. Calls from Vermonters to that national line have increased by 27% from April to May. We don't have the same demographic information regarding race and identification of sexual orientation or gender identity. However, we do have it for age. And so what we've seen from the crisis text line is that it is a broader age group. From the lifeline is that it is a broader age group than the text line. So I personally think that older Vermonters do text. My parents are now texting. I think it's really catching on. But as of right now, it seems that when people are in crisis, they're feeling more comfortable calling the line if they are over the age of 25 versus texting. So again, this is good news in that we do see older Vermonters accessing this line, which means that it could be a comfortable resource. Next slide. So this is our last point before we'll move on and have the Department of Health share some data. But the article from the journal talked a lot also about opportunities from pandemics, which I do think, and I've said this a lot, and I'm trying to really remain constant about it, is yes, we are very much concerned about increased risk. Yes, we have seen an uptick in May that has us exceptionally focused on this data, what we're doing, and how much more we can do. However, Vermont has shown a lot of resiliency thus far through COVID-19. And we really feel like that's helping prevent suicides is those risk mitigating factors, and it is people finding community connection and remaining at least somewhat socially connected, even though they can't be physically connected. And so there are opportunities here, and research indicates that suicide rates have declined in the period after past national disasters. We saw that after 9/11. It's been shown for other major events in history as well. And so one hypothesis they talk about in this article is the pulling together effect, where when you're experiencing a shared experience, you can feel less isolated, and it can strengthen social connectedness. So that is something that it could be a spark that we could flame that could help us sort of build together more connecting fabric amongst the Vermont community. Additionally, we've seen huge advances in technology. I think telehealth was something that had been marching along at a certain pace for a long time. And then once COVID hit, it really forced the issue. And so video conferencing, telehealth, connecting with old friends online through Zoom meetings. One of the things that was great about our crisis text line data is it asked people, what are you doing that helps and what makes you feel better? And the vast majority of people said, I'm actually connected with people I haven't talked to in a really long time. You know, creating Zoom meetings with my old high school friends. And so that kind of people accessing technology in a way that they might not have before is an opportunity. Also, interestingly enough, growing national anxiety can normalize the experience of individual anxiety. I found this, I'll tell a personal story. My husband is an anxious fella. He's always been an anxious fella, and he's always felt like an alien because of it. And now he turns on the news and he's like, oh good, everyone's anxious. So it makes you feel a little bit less out on an island and more of, you know what, it normalizes those feelings, and you can look around and realize you're really not alone. And then lastly, epidemics and pandemics can also alter one's views on health and mortality, making life more precious, death more fearsome, and suicide less likely. And that is a direct quote from that Journal of Psychiatry article. And I just think it is an important thing for us to think about and how we can draw on those strengths to continue to build preventative factors across Vermont. And that is all I have to get us started.
Very good. Thank you so much, Alison, for that context, background, and information. We're going to go now to Jelinek, who is a health analyst with the Vermont Department of Health and spearheading our suicide data reports. In order to keep the meeting manageable, we have a very short time for this talk. So please direct any questions you have to caitlin.jelinek@vermont.gov after the meeting, and she'll be happy to answer any questions you have. And we'll also put that email in the chat. Thank you very much. Caitlin.
Thank you so much, JoEllen, for the introduction. Hello, everyone. Today, I have probably met all of you at some point, or most of you. So today I'll be talking about the weekly suicide report that we have been publishing on our website and updating the data every Friday. So this data was last updated last Friday, and we are looking at trends in suicide for 2020 and comparing that to a 5-year average. So we have data through last Friday, and that is showing that for the month of May, we are seeing a higher than normal number of deaths by suicide in Vermont. And so this data is looking at anyone who had taken their life in the state of Vermont. It is missing individuals, Vermont residents who pass away outside of state, but that is what we have for, today. And then another thing to note, we did add some statistics on age and gender. Melissa, I don't know if you can scroll down at all, or if it looks like it might cut out. Okay. All right. So we do have, so not on this slideshow, but on the website, we do have some statistics for age and gender. Right now, the data is looking pretty consistent, or consistent with what we've seen in the past 5 years. So we don't see anything startling there. We do see that individuals over the age of 65, in 2020, we have like a few more deaths than we would typically have in the past 5 years, but nothing is statistically significant yet. So meaning nothing is overly concerning yet. And then the other piece of data that we have is data coming from our emergency departments and urgent care centers. And so we're looking at here in this graph is visits related to suicide ideation and self-directed violence. So one thing to note is that since we've had the stay-at-home order that was issued around mid-March, we have seen approximately a 50% reduction in our overall ED volume. And then I think it's like a 40% reduction in ED visits for suicide ideation and self-directed violence. So just something to keep in mind. It doesn't really make sense to compare the 2020 data to the historic data in that grayed out box period on the graph. But we haven't seen anything, any significant increases over this period. I've been in touch with several states, keeping tabs on if they're seeing increases as well. And so far they haven't seen anything yet. So that is just some of the data that we are monitoring and updating on a weekly basis.
Thank you very much, Caitlin. We know that a lot more time than that goes into collecting and reporting this data. We thank you for standing by in follow-up questions that people may have.
Yeah, of course.
And we're probably going to turn your video off now and move towards a coalition member conversation at this time. It would be great to have Alison back on the screen if possible. Alison and I are going to piggyback and manage this this chat with the coalition. This is in some ways a grand experiment. As you know, our last two meetings have been the first virtual meetings we've had, and we do have about 45 people participating this morning, which is a great thing. So please be prepared to use your chat bars. These are the questions we'd like to review, and Alison is going to pose these questions. We'd like you to chat your response into the chat box. The conversation is larger than the container we have set for it today. We're interested in using the time to begin the conversation and receive some quick, immediate feedback for the state agencies. We will be watching your chat for inputs and requests to unmute to share. There will be limited opportunity to share verbally, and we'll call on you to unmute yourself. Please know that we're capturing all of the information that is put into chat this morning. So with that introduction, I'm going to turn it over to Alison, and she will move us along in posing these questions.
Okay, so as you can see, our first question for the group today is, what is most important for prevention right now? So we have definitely talked about this as a coalition in general, and we're very interested in what people think given the current state of affairs in the state of Vermont and the nation and the globe. What would you say would be the most important piece for prevention to be doing right now?
So we have one response from Julie Parker representing the Blueprint today. Screening, Terry Lavallee, working with Northeast Kingdom, says connection. Copeland Center offering more opportunities for peer support. Psyche says access to and awareness of prevention resources. Melissa, representing SASH, increasing opportunities to connect. Others, keep them coming. What is most important for prevention right now? More proactive outreach to people and groups who might be at risk. This would include expanded screening. Sorry, I just flipped my.
And assessment. I
And
can see that. And that's Tom Delaney, right?
Yep, Tom Delaney, who does extensive suicide evaluation and research with the coalition. Matt Wolf from Vermont Federation of Families, so very close to the family unit, direct service care system. I think connection and similar to your husband, the normalization of increased, can you read that, Alison?
Increased anxiety and strong feelings. It's okay, and we are here for each other. And he agrees with Tom that increased outreach could help.
Reaching out to our friends, families, and colleagues, anyone who we think may be struggling and or at risk. Linda Livendale, agree access to more prevention resources. And what kind of prevention resources are we talking about? A couple of people have mentioned prevention resources. Engaging multiple sectors in promoting resources.
Yeah, that's an interesting point, Charlotte, because we've noticed, we've been talking about this a lot, that we seem to maybe be missing sections of the population, and maybe we're only messaging in certain places. And I think that also goes to Tom's point about targeting certain groups and how we do that well.
Call centers, counselor who can provide in-person response to calls. Do you want to talk momentarily about our crisis response centers, Alison?
Yes, so we've been working to bolster call center response. I think this is happening in a few places, and so we certainly have a DA crisis system that the phone during the day, but does have a pager system at night and on the weekends. We have the warm line through Pathways that during COVID has been able to go 24/7, and they're really working to try to see how long they might be able to sustain that, and that's something that the state is also interested in supporting. And then we have our lifeline, and so that's the National Prevention Lifeline. And historically, it wasn't answered in Vermont, and the problem with that was a few things. One is it's supposed to be, which I think for a long time it just wasn't how it was marketed, and people assumed it was a national resource, which it is, but the resource is to provide one phone number, and they're actually going to be changing that 1-800 phone number to a 3-digit number, 988, and that'll be happening fairly soon, I think, probably by the beginning of next year. And so
yeah,
we think that will really increase call volume, but we've been trying to work in Vermont to have those calls answered in Vermont. And right now, Northwestern Counseling is our one center who is currently answering the phone. Pathways is due to become on board in the fall. And then 211 has been a support for that for a long time, but with COVID, they were really overwhelmed with the amount of resource provision they needed to provide to people. And so they're taking a break from that right now.
very good, thank you. Isolation, Lori Emerson from NAMI says, isolation has gone on for a long time, so people are really wanting in-person outreach. These call centers and response are very important right now. Caitlin Miller at Healthcare Rehabilitative Services in Southern Vermont says ensuring access to technology as well as making sure needs are met for food and shelter. HCRS has made individual connection plans tailored to every specific client. Thank you for that, Caitlin. Building more advocates, as Charlotte mentioned, across sectors. Prevention is something we need everyone working on every day. And I think this speaks to comprehensive approaches to suicide prevention. It's been very interesting to me as the mental health agencies shore up their pathways to care and response. They're also seeing the need for working closely with community partners. Because as we've talked many times, this cannot rest on mental health alone. And so all of the different services offered in the community connections are important. And Matt Wolf echoes addressing basic needs, as Caitlin suggested, makes a lot of sense in terms of individual plans. No one person has the same needs. Everyone every day is going to take communities taking care of each other to reach more people. And that may be the message right there that is a good one for a PSA campaign right now, Alison. Everyone, every day. And making gatekeeper training and increasing people's comfort to have conversations about suicide prevention. Michael Hartman, Director of Lamoille County Mental Health, says crisis response is great, and closing the door when the cows are running out. We need better ways to identify people sooner and get them into our systems of care. Use of the Columbia Suicide Severity Rating Scale screenings and how to use those in times like these. 80% of suicides occur with people who don't show signs and also are not in our system of care. So I think we can start looking at providing more training on really basic screening. Several agencies have also set up COVID-specific warm lines to respond to community need. It's an opportunity to reduce COVID-induced stressors that may or may not feel specifically mental health related to the caller, but can be an important prevention resource. And then before we go on to the next question, gun retailers, gun owners, vets, and parental gun owners need to be brought in as partners. For example, the Gun Shop Project approach. Okay, perhaps we should move on, Alison.
Yes, and thank you. I'm already
record all of this and make sure it is translated into strategies.
Great. No, and I just want to thank everybody. I'm already energized by all the thoughts and comments. We just have such a great broad group here. And so the other thing that I think, speaking as a state person who can tell you, here's what we're doing, I think we sometimes don't know about everything. We all suffer from this, right? But in particular, I know that there's lots of efforts going on the ground, and yet at the same time, we don't know about all of them. So we would love to hear from people about what is happening that we should know about. I think why recreate the wheel if there's some successful projects and policies, shifts in practice that are happening that you think are something that could be worth sharing and duplicated.
And I think given the time, I'm going to fold in the second question here. So what is happening that we should know about? Please just type that into the chat. And what would you like to see happen?
That's a really interesting point from Melissa, who mentioned that COVID has increased or highlighted ageism, and she would like to see some more positive messaging about aging.
Peer support groups are very important. The Copeland Center is offering them online. It's had pretty broad reach, but we continue to have folks who want to attend. Internet connection continues to be a challenge. Others? Hotlines, warm lines, yoga Zooms for self-care, emphasizing self-care for our healthcare first responders, our community providers, our educators, self-care, caring for others, warm reach outs, visits in outside, Zoom trainings for awareness, Zoom coffee hours keep us connected. NAMI Vermont has seen an increase in people starting to reach out. They have been suffering in silence for quite some time due to anxiety with COVID. Great increase in stress, anxiety, depression within corrections department, surely. This may be a time for us to think more strategically about working with the Department of Corrections. Many who have been living in funded hotel rooms are and will be homeless. I'd like to see people go door to door in neighborhoods.
We did talk about that, a neighbor to neighbor campaign. And I think what's tricky is some people get really anxious about someone coming to their door during this time. So it's a tricky thing to balance with COVID going on. But yeah, I really think that somehow letting your neighbor know that you care and you're checking in, and how can we do that in a safe way?
Continuing to educate people with clear and concise knowledge about the virus and transmission to help decrease that anxiety and empower more confidence. In Addison County, same as many designated agencies, daily COVID support line, also case management and COVID support where vulnerable people live, shelters for more informal mental health support, and to help people into services if they'd like. Excellent suggestion, thank you. Identifying, recruiting, and training community members who are in positions to have a positive connection with others and providing them with a basic set of tools to ask about and respond to self-harm, broader than suicide, basically broader gatekeeper trainings. Thank you, Tom. HCRS is doing targeted engagement with folks placed in hotels to connect them with service. Also meet and greets at food distribution sites to make connections and offer services or connections as needed. Front Porch Forum is a good way to reach out and provide information to neighbors. And those are in every community. That's an excellent suggestion. Rutland Mental Health has rapid response. If a kiddo goes into crisis and receives crisis assessment, not open to services, we open them up immediately to support services, no matter whether insurance is at play. These services include immediate stabilization while on the wait list for outpatient treatment, have found that even though the kiddos are in crisis, so is the family, vital to support the whole family. Thank you. And Alison, we have one more question. We're going to run over just a few minutes, but let's put the question out there and see what we can get in just a few minutes response. And I think actually some people have offered some good suggestions about this already. Go ahead.
Yes, agreed. And this is a hot topic amongst all of the departments at AHS, is what are the most important messages? Sometimes we suffer from sending out just tons and tons of information. We're really looking for what are we not saying that we should be, who are we not reaching that we need to, and what do you think are the most important messages right now?
It seems like there's more awareness, positive and negative, on substance abuse during COVID-19. Maybe some kind of broad messaging about substance misuse and associated mental health risk factors. Substance misuse is upstream of a lot of suicidal behaviors. Absolutely, we know that about 50% of suicides have some direct association with substance misuse, either at the time or before the time of death. So very important, and we're working actually on trying to create more intersections in Vermont between substance misuse and mental health services. But the messaging here suggestion is very interesting and important. Thank you.
Yes, I shared with a group of, with DMH leadership, a message that I got, I think it was from HBO actually, that the message was, it's okay. And it was really kind of going back to Matt's point of saying, it's okay to not feel like yourself right now. It's okay. And so that's something we've thought about, but we're also, again, just not sure that the message that we're putting out there is the right one, reaching the right folks.
And I think we've gotten a lot of input here today about what some of the messages are. And I love this suggestion, provide more information through the various social medias, just maybe on for adults, the Facebook accounts, some messages we could go out that people could share, and messages on Instagram and some of the other social media that young people are using. We're looking at doing that right now and are doing it with our You Matter Youth and Young Adult program. And we have some youth actually engaged in tailoring some messages, which is an exciting prospect for us. It's important to remind folks that we're still here, we're not closed. Also, and it's okay to use our services for those of you who have not been comfortable in the past. Also, with kids returning to summer camps in some communities, we're hopeful to be able to catch some kids who may have fallen off the radar. As school lets out, maybe attempt engagement at school lunch pickup sites. Very nice idea. Communities need to pull together, not divide, support and acceptance and help versus judgment and criticism. We've got this. We can work together. I think on that point, we're going to have to close the conversation, Alison. And we will be recording all of these suggestions, a lot of good concrete input here. I want to ask Debbie Haskins if she would take over the camera at this point in time. There you are. Hi, Debbie. Alison, thank you very much for your leadership on this issue, your research and your focus on quality improvement, your partnership with us and many nonprofits, and recognition of our need to work across sectors with all sectors, public, private, and community nonprofits. So thank you for your work. I'm going to introduce Debbie Haskins, who is a suicide prevention specialist and a You Matter trainer with Center for Health and Learning in the Vermont Suicide Prevention Center. We've asked her to do Debbie does a lot of work in postvention on behalf of VTSPC. And we appreciate when you let us know that there has been a suicide in your communities. We will put whatever actions into gear that we know we have capacity to connect with, especially the mental health agencies who often hear about these firsthand. So Debbie, a few words about postvention, which is critical to prevention.
It certainly is, JoEllen, and thank you so much for the time today to talk about postvention directly. It is not something separate from prevention. The goals are to help and directly impact both the trauma and the grief that can happen in a community, to help the community to be stable, to restore some type of order and routine. It's to help prevent further suicides from contagion. It's a crucial time to know what best practice is, and it gives you the time to educate your community and members of your agency perhaps about education and best practice. So we really thank you today for just taking this short time. And what's come out of this conversation is that two of us, and I will talk a little bit more about this, will be offering some future webinars through Center for Health and Learning. So a definition of postvention is, as you see on your screen, it's the first one is obviously when there has been a suicide. That's when postvention kicks in. But one of the key factors about that is we don't always know who it impacts. And one of the things about doing this work is that's why it's so important to do a collaborative approach. And you'll see more in just a moment about that. We want to be mindful in the education of postvention that to always talk about the complexity of a suicide. And this is a CDC slide that talks about the many pieces that are factors, and there are many more. Sometimes without ever meaning it, people often will think about the last thing that has just happened for a suicide. So again, this is a time that we can talk about all of the pieces. And as both Alison has talked about with the data, we are seeing more substance abuse use, and especially with the kids, I'm hearing at school levels, with the time that they have home, they are using more, and that's anecdotal. So one of the pieces about postvention is, in fact, really dealing with contagion, both with youth and with adults. As we look at postvention, it is an integral part, as you can see, of comprehensive approach. Many of us have talked about today about how do we assist people, how do we approach prevention, how do we talk about the linkages, and we always want to focus on prevention, even within a postvention response. And within that, I'd just like to say that I spoke with Linda Heimerdinger, who is also a clinician at Brattleboro Union High School, and is not able to be on the call today and works a lot with us and will be helping both myself and Charlotte McCorkle, who is on the call from Howard Center. We will be offering an hour-long workshop in August and in November to further discuss postvention techniques and the importance of it. I wanted to really key that one of the first pieces of all postvention, of course, is knowing your mental health agency, having, whether it's a contract with them, having key members that you've talked to. If you're a school, you have them on your team. You have them in your trainings. They're an integral piece, and this particular mental health crisis map shows where everybody is. It's on the Center for Health and Learning's website. This is something that I found that is a real helpful tool to give to everyone in their community, because again, Vermont's a small state, and while it may be in Franklin County or Lamoille County that the death occurred, because of technology, it affects many across Vermont. So I'd like you to just for a moment within your own agency, think about these questions. What is your agency's communication plan? Who knows about the suicide? Who talks about it? How do you implement each phase? Where is your policy around this? What supports, and I heard someone mention before, I think it was you, Alison, about how important it is to remember that we're all in this. A postvention plan talks about not only what happens when there's a death by suicide in your community, it talks about what happens if it's in your agency. What if it's a spouse of someone? What if it's someone famous? How do we handle all of those? Along with best practice, you need to have protocols around the media. Who talks to the media? What needs to be said? And all of these guidelines can be found at the VTSPC website, both the media reporting guidelines, as well as some role-specific guidelines that were put together for UMatter. So what can I do today? What is it that I can walk away with? What do I need to do differently today? Well, first, as I said, you really want to know what procedures and policies that you have specific to all factors of postvention. You want to know your national and local resources. As I just mentioned a moment ago about what are local, you also want to know the counselors that are within your area as well as the designated agencies. There are phenomenal amounts of national resources. And Interestingly, I just had a call with someone in North Carolina who wanted some resources, and I was able to go on and get them. So it's really important to know them and know where to get them. And if you haven't attended a postvention training to learn about what the best practices are, it is crucial to this work and how we continue to manage contagion. This is the website that Vermont VTSPC and through Center for Health and Learning has. You will see under the section of resources, there are specific protocols to every different profession that were put together. And it's part of what we do in a community training to help everyone in the community to realize what their role is and how they can be better prepared if there is a death by suicide. I just wanted to say in closing that Charlotte and I kind of shared some of the same goals when we talked about what we wanted people to walk away with. We want you to know about the SAMSHA website. We want you to know about that obviously suicide is preventable. We want you to know about the existing relationships that you already have with your partners and to be thinking outside of the box. And the time to do much of this work around postvention is when there is not a suicide. You want to have these conversations when there isn't a crisis, when everyone isn't feeling the pain, and to remember that sometimes this is the first and maybe only connection with a mental health agency or with a counselor, and to really guide people into an opportunity where the agency can talk about all of the services. And I know we have several people on the call who represent agencies who put some great suggestions up today in our chat box about all of the things that they do. And this is key. We want to close today with looking at our help card that we offer through Center for Health and Learning. These can be ordered in bulk, they can be downloaded. This is the newer of the cards, and I think Gail is still on the call. Finkelstein is that we have the Northern New England Center for Poison Center also on the card now. Alison represented the text line, which we encourage every time. These are imperative to have actually on you, with you at all times, because you never know when somebody needs one of these cards. And again, they can be accessed through the Center for Health and Learning as well. So I do want to thank you for your time. As I said, you will be receiving some further information as to the dates for future webinars on a full postvention discussion. Thank you.
Thank you, Debbie. This is JoEllen. I'm coming back on. And again, in postvention, we want to thank our partners who inform a lot of the work we do, both nationally through SAMHSA, the Suicide Prevention Resource Center. Charlotte McCorkle contributed to this from the Howard Center, and Linda Heimendinger, who has been a long-term coalition member representing schools. She is a social worker at Brattleboro Union High School and was in the first cohort where we implemented UMatter for schools, and has been consistently using UMatter postvention and prevention. And one of the first things that we recommend is that you reach out and ensure, as Debbie said, that you have relationships with your local mental health agencies and providers so that when you need to respond, you can do so with confidence. Okay, I'd like to move into the final section of the meeting. Thank everybody who has participated. I do want to mention that a large portion of our funding for Vermont Suicide Prevention Center comes from Department of Mental Health. They support the Vermont Suicide Prevention Center website at www.vtspc.org. This is our website as a coalition. Please continue to use the calendar, send us your events. We will post them on social media, that is VTSPC, again, supported by the Department of Mental Health. So consider that resource your resource as well. When you look at our pages, which we're constantly trying to improve, and you see improvements or suggestions, please feel free to let us know. We're also going to make a significant effort in the coming months to reach out to you to ensure you are well linked to the VTSPC website as a partner, and that you link to VTSPC, Department of Health, and Department of Mental Health as sources of information. I will start the announcements, and then we'd love to have any others that people share. You can get on the mic, or we do have a couple minutes remaining, or you can share them via chat. We have put together a series of webinars, UMatter and overviews. They're awareness raising overviews and zero suicide overview webinars. These are available in Vermont free of charge. The first one is actually tomorrow morning, a zero suicide overview at 8 a.m. You can register at www.healthandlearning.org. These are meant as engagement activities to engage your organizations with a level of awareness that puts you on a pathway to implementing technical skills and tools of the trade. To try and implement those best practices, often without the awareness that is needed, sometimes sabotages our efforts in the early stages. So please spread the word about those webinars when you see the information about them. We're also getting more and more excited about the Vermont Suicide Prevention Symposium as we engage some really wonderful, knowledgeable experts and people from communities who are implementing innovative suicide prevention best practices. For the Suicide Prevention Symposium, August 18th. The date is not there, but please mark your calendars, and we will be putting out some marketing specific to the VTSPC very, very shortly. The focus is on bringing resiliency into focus. I want to acknowledge the planning team. We've really got some inspiring speakers and workshop planned. Fall meetings of the coalition are now set for September 10th virtual, and December 10th format is to be determined based on guidance and safety guidelines. So we're looking forward to reconvening with you all, if not before, on September 10th. Other announcements, please share. Melissa, I'm wondering if you could review some of the announcements that are coming through in chat.
Haven't been any quite yet.
Okay.
Yes.
Any announcements people would like to make? All right. Elliot, thanks to Tom for those. Yes, the last thoughts about some effective messages with regarding to means safety. And these are absolutely critical, and how we approach this messaging is very important. Tom has made some very good suggestions about the messaging relative to general safety messaging. And so we will also make note of those. Any final announcements? I'm going to invite people to put themselves on camera if you'd like to say goodbye. It's always so wonderful to see faces with names. And please feel free to follow up this meeting with direct messaging to Alison Krompf, alison.krompf@vermont.gov, or us at Center for Health and Learning. Thank you.
Thank you, everybody.
Thanks, JoEllen. Thanks, Alison. Thanks, everyone.
Thank you. Bye-bye.
Thanks all.
Hi, Ruth.
Thanks, Ed. Thanks, Carolyn. Thanks, Debbie. Bye.
We're down to 14 people.
Yes.
Stephanie is online. Hi, Stephanie. Thank you all.